Hi, this is William Guta. Allow me to present to you Zanninello from PSG, who will be highlighting the importance of medical aid post-entry retirement fund. Thank you.
Good afternoon, everyone. Nice to see you all. I have been introduced as being from PSG and dealing specifically in today's topic with regards to Discovery Health, the UCT medical scheme. But some of the basic fundamentals that I'm going to talk about today are applicable to any medical aid. So even if you aren't on the UCT Discovery Health medical scheme, please do ask questions on other medical schemes and understand that the basic tenet of saving money in your pocket and being wise about what benefits you've got applies to any medical aid. Understanding what you've got and how to get the best value for money, that will apply to all. So really what we're going to do today is understanding what cover level you need, where do you go to from here, and what are our services in retirement, because as a UCT retiree, we will continue to service the medical aid, and you continue to have access to Diane or myself or to Carol if you have questions or queries or need assistance. So, I would like to look like that in retirement. And I'm sure the gentlemen would like to be married to ladies who look like that in retirement. But we don't all look like that, because we all started from a different place. So while we would like to look like that, and while we would like to be comfortably retired, we may not all end up looking like that specific end product. What you need to know is that you're going to make the best with what you've got. So I may not look like that when I get there, but I hope I look the best version of me when I get there. One of the things that you need to look at when you're talking about your medical aid or thinking about your medical aid in retirement is, do you understand your plan? Do you understand the options that are available to you? The one that you're on and all the rest of the ones that you have access to. Do you know how to maximize your benefits? And do you know what you are entitled to? I know there are a lot of people who know more about the ins and outs of their cars, which costs half what the medical aid costs, and don't know exactly what cover they're on. You need to understand what your family have spent in the past few years in order to determine if you are appropriately insured, because going forward you have to make those decisions when you have a very small pool of money within which to pay for the medical scheme contributions. Analyze your out-of-pocket spend. Am I overinsured or underinsured? Can I reduce what I'm paying the medical aid now in order to free up more cash so I can put it into my retirement funding so that when I do retire, I've got more money to pay for a more comprehensive medical aid premium? Look at the differential between the premium and the requirement. Is your plan the correct level of cover? And it might be a little bit confusing today when we talk about it, but I'd like to sow the seeds, because you have access to Diane Wilson, who sits in Bremner, and you are welcome to make an appointment with her and discuss this on an individual, personal level. We've also provided letters for those of you that we knew were going to be here today that states what our opinion is as to what your plan is, whether we think you're overinsured or underinsured, and we have all of that information available for you as well. One of the other things that we've noticed is there are a number of people who have adult dependents that are not their spouses on the medical aid. One of the things that you can do is remove them from your medical aid, put them onto something cheaper, so that you're reducing the cost that you're spending. Because if you're on a fully comprehensive cover and you need that level of cover, you're paying a very high contribution for your adult dependent children. And you might want to move them off so that you can save contribution and put more money into your retirement funding. One of the other things that you need to understand is what your budget is when you've retired. Have you asked your financial planner to calculate the cost of the medical scheme contribution, because by then it's going to be quite high, into your budget for when you retire? There are a lot of people who don't automatically include that as an expense in their budget when they're looking at making sure they've got enough money to retire. So you need to remember that and calculate the cost, and that's why we've also given you the contribution going forward. Medical aid is medical aid. The most important thing to me when it comes to choosing a medical aid is what you are paying for, what you are getting and what you are paying for. So in those famous words, show me the money. Am I paying too much? Am I not using it enough? Not getting enough benefit? Or have I chosen an option that's lined perfectly with the amount of benefit that I need to get out of the medical scheme. And then you remember that you can change your medical aid options for years where you're going to know you're going to spend more, and then reduce it again in the years that you know you're not going to spend a lot. And we're not now talking about your major medical expenses, we're talking about your day-to-day benefits. So, when it comes to premium flexibility, do you know that on your medical aid, you can choose to be reimbursed at medical aid rates, or what we call the scheme tariff, or at the classic rate, which is 2 times the medical aid tariff. On top of that, you have gap cover, okay, which is quite a low premium, and that gives you an additional 5 times medical aid cover in hospital. So if you are on a plan that's covering you at 200%, you could reduce your premium on the rate where you are only getting cover at 100%, and for a very small portion of that premium reduction, pay for the gap cover, which is then going to give you 500% and put you in a better position than if you chose the classic level plan. Delta hospitals, for those of you who can't be on a coastal plan because you have family dependents that are resident in Gauteng, the Delta hospitals are an option where you can reduce your contribution by about 10% to restricting yourself to specific hospitals. The coastal is probably the best value for money plan that Discovery have currently. And for those of us who are resident, I'm resident in KZN, you are resident in Cape Town, we have really good benefits here for a much cheaper contribution, and I'll show you later how that works. And then in terms of the key care plans that are your lowest level of cover that you can provide for on Discovery, they tell you which hospitals you can access. They're still private hospitals, and it's still unlimited cover, but you can't have access to all the private hospitals. And then, of course, on that specific plan, there are also certain benefit exclusions, which may not necessarily be appropriate for you. So there might be things like joint replacements not covered on that plan. But again, when it comes down to it, if it is the only option that you can afford, better that than nothing. Again, when we look at premium flexibility, determine, are you using chronic medication or not? Okay. Do you need the comprehensive plan's chronic benefits, or do you need the chronic benefits that are available on the lower plans? Look and see which will cover you how, because they all cover you up to a specific rand value of the cost. And then make the determination whether you can move from a comprehensive plan to a lower level plan and perhaps save your 1,000 rands worth of premium a month, where the differential in what they're actually paying towards your chronic is only 100 rand. You would still be in a net positive position. Use places like MedExpress and the formularies in order to make sure that you are covered in full, saving yourself money again so that you can put more money towards your retirement. And then use the MedSaver benefit via clicks. There are many of us. I know I've just gone through an entire tube of Carenza C's myself in the last week, who buy that kind of over-the-counter medication, and if I do it through the MedSaver at Clicks, I get 25% of the cost of 100 or 120 rands worth of medication paid back into my bank account. So understand what benefits you have and how that can create more cash in your pocket. So, we spoke earlier about, do I take the 200% level plan, or do I take something like Coastal Saver, which covers me at medical aid rates? And what does that mean in rand terms? So I've just taken a husband and wife, because hopefully when we retire, that's just the two of us. We don't have any more children or grandchildren that we have to pay for. And I've shown you the monthly contribution. Classic Saver is 3,500 rand a month, and Coastal Saver is 2,700 rand a month for a husband and wife. And this is the total contribution. We're not talking about the company's subsidy or anything like that. And then we look at the amount of money that they give you annually in savings, because it forms a part of your contribution. The only difference in cover between these two plans is the fact that you are covered at 2 times the medical aid rate in hospital, and the fact that you can access any hospital anywhere in the country, whether it is an emergency or a planned procedure. So if we take the difference in premium, we take away the extra benefit in terms of savings that you get on something like Classic Saver. We take away the cost of the gap cover, because you really should have gap cover on something like Coastal Saver to bring you up to your 6 times overall cover. The real premium difference between these two plans is 477 rand a month. who couldn't afford to put, or who wouldn't like to put an extra 500 Rand a month into their pension fund or into their personal savings? Okay? So these are the kinds of things that you need to be alerted to in terms of how you can still get the best level of cover, but pay the cheapest contribution that you can possibly do, or a cheaper combination of cover. When it comes to day-to-day benefits, what kind of premium flexibility do we have? If you are on a plan, the comprehensive plans or the priority plans, you are paying for something called an above-threshold benefit. It might be unlimited, like on the comprehensive plans, or it might be limited, like on the priority plans. But if you never reach the benefit, so if you don't spend enough money to get you through the self-payment gap and into the above-threshold benefit, you are paying for a benefit that you are not using. You are paying for somebody else to use the money that you're putting into the medical aid. And I don't know about you, but I much prefer to save money in my own pocket than to give it to somebody else to manage for me, like the medical aid. Okay? Because once you've done that, at the end of the year, it's gone. And remember, if you do make the choice to downgrade and then you need to upgrade again, you can do so every year for the 1st of January. So do you reach your above threshold benefit annually? Are you using that benefit? And how much do you spend once you're there? Because some of us literally reach it in the last month of the year and nobody goes to the doctor when it's December. It's amazing. You see a scheme's claims lines, and sort of June and December, there's a huge dip in terms of the claims that are submitted to the medical aid. And then compare the premium difference. So if I'm only just getting in and spending maybe 1,000 Rand or 2,000 Rand in my above threshold benefit, but it's costing me anything from 1,000 to 3,000 Rand a month more, that's a huge amount of money annually versus the actual benefit that you are getting. Now, if you are wealthy and you want to buy the highest level of cover and you want to be fully comprehensively insured, that's your choice. But if you want to be clever about how and where you spend your money, because even some of the richest men in the world pay on a certain day of the month so that they don't incur interest, that's what I would recommend that you do. Look at what you're spending and what it's costing you to be overinsured. Then at least you know what it's costing you in terms of peace of mind. On the saver plans, how much are you spending that's not submitted to the medical aid once the savings account is exhausted? So if you want to upgrade or if you want to judge, look at how much savings you've got and then look at what your out-of-pocket expense was once your savings was exhausted. And is it really worth for maybe 2,000 or 3,000 Rand in the year that you paid out of your pocket to spend another 2,000 or 3,000 Rand a month to be on a higher plan? So when we look at something like the classic priority, and again we compare it to the coastal saver, we look at the monthly contribution, we look at the annual savings. We do that deduction in terms of how much more savings you get on a classic priority plan. We figure in the cost of the self-payment gap, because to be able to reach the above threshold benefit, I'm sure if you're on a threshold plan, you have felt that self-payment gap, because it doesn't go away. You have to incur it, and it's an expense for you. And then we look at the value of the limited above threshold benefit that is provided for a couple, which is 14,500 Rand. And you require a gap on both, so that's really neutral, because on the priority plan you have those upfront deductibles, so you have to have the gap cover for that. And then the real premium difference annually is 2,600 Rand that you are spending more on the priority plan. Okay? So you're spending 2,600 Rand per annum more to be on classic priority, where you've got deductibles that you don't have on a coastal saver, and where your cover is at 200%, but you've got the extra gap cover that takes you on both plans up to 500%. So really, do you need to be on a classic priority plan when you could perhaps put the addition or the benefit or the premium savings in your bank account and fund whatever you need to once your savings is exhausted out of that? So if I do decide to move from a comprehensive plan to a saver, what am I losing? What benefits am I losing? Oncology is unlimited on both plans. Okay? The only thing is that on the comprehensive plan, you've got 400,000 Rand that's paid at in full. And on the saver plans, you've got 200,000 Rand that's paid in full. Thereafter, on both plans, you have unlimited access, but a 20% co-payment kicks in. There are technicalities behind that. So if you have a condition that's PMB and you're taking the special, you've got PMB treatment, there won't be that 20% co-payment on any of the plans. Then your cover is in full. But not many of us take something like a tier 1 kind of oncology treatment when we have cancer. Your chronic medication benefit on the comprehensive plan covers a much longer list. So it covers things like depression on that plan that it doesn't cover on something like a saver plan. And they pay a higher chronic drug amount. You also have access to biologics for things like rheumatoid arthritis, which you don't have on the saver plans. And then you have access to the CDE program, which is special treatment for people who suffer from diabetes. You have the above threshold benefits. You have specialized medicine and technology benefits. So it means that if you wanted to have special treatment that wouldn't ordinarily pay for, you have more chance of getting that covered on comprehensive than you would on a normal saver plan. And then, of course, if your treatment can't be provided in South Africa and you can afford to fly yourself overseas to get the treatment, then you have an overseas treatment benefit on the comprehensive plans. Most of those, if you're not using them, you're paying for something that you're not benefiting from. And if you do need to use them, you can always upgrade so that you can have access to them on the 1st of January. Always weigh up the probability of you using those benefits against what you could save. And remember, the risk is only in terms of what's left in the year that you have to get through before you can upgrade. If you think you won't be able to afford anything, as I said again, the very cheapest plan is better than no plan at all. And every year we say the same thing, and every year the figures stay the same. NHI is 15 to 20 years off in the distance. It's not going to happen anytime soon. They're running into more and more difficulties as they're trying to do something that's hugely problematic, greatly needed, but still a huge task for them to roll out. So then look at the key care plans, at least, because it is unlimited cover and it is private hospitalization. And one of Discovery's largest claims ever was 9 million rand, and it was paid out on a key care core plan, purely hospital cover. And they paid for it in full because it was a PMB condition. It's income rated, so if you're earning a pension and your pension is far lower than what your salary was, your premium will be far lower. A member premium, and the way the UCT subsidy is structured, is they pay half of the Coastal Saver plan. But if you choose key care, it almost covers the entire premium in certain income categories for the key care plans. So you would pay almost nothing out of your pocket. So if your income was below 6,650 rand, you would pay nothing. The subsidy would cover the full cost of the plan. If your income was between 6,600 and 8,800, you would be paying 195 rand out of your pocket. If you were a couple, 585. No, the 585 is for the higher income level, 8 plus. You get unlimited access to private hospitals and unlimited access to GPs, blood tests, x-rays, primary health care. But at least you can have your eyes done and you can have your teeth done, the checkups and things like that. I'm not recommending this plan now for everybody. It's to say that if it comes to it at retirement and funds decrease and you've had investment losses or something like that, then rather buy this than nothing at all. So where to from here? Consult with us. In the letters, we've also given you a meet the team document, our lovely photographs, and our contact details. So if you're not comfortable dealing with Diane or you want to send me an email, unfortunately I don't do face-to-face. It's a bit difficult because I live in KZN. But I'm there to give you advice on the telephone or electronically. Diane is on site, so you can sit in front of her and she can talk you through it and draw pictures. Some people work better that way. I know I do better when there's something depicted graphically. And we will assist you. We will tell you whether we think that you are overinsured or underinsured, and we will show you the differences and guide you. And at the end of the day, it will then be your decision to make. Make a conscious decision about your cover levels. I'm sure that when you had the retirement fund speech, and I've sat through many myself, where they say people are still on the same kind of level and with the same investment portfolio that they had when they joined 20 years ago. please don't still be on the same plan that you were on when you joined 20 years ago. Make a conscious decision about what you need and how much it's going to cost you. And then where possible, plan your day-to-day care. In the year that you need to have your teeth done and you need to buy new glasses and you need to, have some physiotherapy or whatever, choose that year to be a year when you upgrade to a comprehensive plan. That crown, 4,000 Rand, or a new pair of glasses, 2,500 Rand. Then work out how much it's going to cost you and upgrade. And then make sure that you spend all of that money and then downgrade again the next year. I mean, the medical scheme would cringe if they heard me say this, but it is good financial advice. You buy the level of cover you need in the year that you need it. UCT, as we said, subsidizes 50% of the Coastal Saver Plan to a maximum Rand value, which they determine annually, which is currently 50%. And they will pay the full contribution and collect your portion via debit order. You are allowed to make annual changes. So if and when you win the lotto and you decide that's it, 1st of January, I'm buying the most expensive medical aid I can, go ahead, upgrade. Okay. They can't stop you. They can't place waiting periods or exclusions or anything like that. Okay. Sorry. And then what do? Well, we're here to help you. We're here to help you no matter what. If it's a problem claim, if you've submitted claims to Discovery and they're not paying them and you don't understand why, or you think that they've made a mistake, because they're not infallible, we're there to help. We're there to help register your chronic and explain why you've got co-payments. We're there to help you with benefit queries, year-end option choices, should I upgrade this year, should I downgrade, your vitality benefits, how best to get the most money, additional removal of dependence. So yes, if you have that adult child who's on your medical aid costing you a fortune, we'll help you put them onto a cheaper plan on their own, which they one day might be able to pay themselves. And of course, in terms of Wellness Day communication, we then send out a letter and invite you to come to UCT and have some lunch and enjoy the vitality check that we can prepare for you. It was a lot of information in a very short space of time, but I hope that it's given you food for thought. And if you do want to contact us, our contact details are in those letters. I think they're still outside. If you don't collect it today, then I know that Diane will pop them in the internal mail for you. If you are on the UCT fund, the Discovery Health Fund, and we've got your details. Yes?
What does PSG think the future of gap cover is?
We hope that they won't do away with it. Well, in fact, in the second draft demarcation regulations, they haven't done away with it. They've just adjusted it. So basically what they've done is they have stated that you will be able to have gap cover. You will be able to be reimbursed for shortfalls based on your specific procedure and its severity, and there will be an annual limit, and that there won't be able to be differentiated contributions. So for UCT, there's positives and negatives. Your gap cover, which you currently get at an exceptionally cheap rate, may become more expensive because they can't differentiate your rate from anybody else's. But then again, you won't have waiting periods if you decide to join halfway through the year, for example. We do believe there's a place for it, and I think that government has finally realized that too. They're now just trying to restrict how much benefit it will provide in order to minimize the impact on the medical schemes. Yes?
I just want to find out about, academics go abroad a lot,
Mm-hmm.
and if you have a pre-existing chronic condition, is it covered if you say that, I think it's in the 90-day rule or something? If you have an accident and you suddenly need a lot more.
Okay. There are two avenues that we could follow here. If you are going to go away for an extended period of time, generally what we do is we hold your medical aid. You can reduce the level of cover so you're not paying a huge amount, or you withdraw completely if your family is going with you.
And I want to do the opposite, to be covered when I'm abroad.
Okay, but you're only going to be covered for 90 days. So if you're going for an extended period of time, your cover runs out after 90 days. So it doesn't make sense if you're going to go for an extended period of time. You would then have to go and purchase...
From 91 days onward,
You have to purchase other cover, yes. Something like a Bupa, and we can give you that information, or international travel cover, or whatever.
But that doesn't cover pre-existing conditions.
Sometimes it doesn't, but sometimes it does. It just depends. The 90 days, if you're on discovery and you are only gone for 3 months, let's say you've just gone for holiday for a couple of weeks, then that will cover your pre-existing conditions because it's something that Discovery have bought on in bulk. But your own travel insurance, generally, that you buy for the 90 days plus, that usually has a pre-existing condition exclusion. But if you were to buy something like a Bupa, international cover, that wouldn't have. Yes?
Why is physiotherapy not available for chronic?
Repeat the question.
Why is physiotherapy not available for chronic? I'm assuming that you're referring to something like chronic obstructive pulmonary disease, where you need to have physiotherapy to pound the chest and get rid of the phlegm and all that kind of thing.
The other chronic conditions
Okay.
related to your sort of musculoskeletal system.
It's very difficult to answer. The short answer is that government sets the PMBs, and because the medical aids have to pay on an unlimited basis and they can't protect themselves, they will then pay only to what the government is prepared to provide along clinical guidelines of that sort. And it's not. It might be provided on a short-term basis if you were in hospital, but not on an ongoing basis. And that's what they generally base their chronic cover on. If you are on a comprehensive plan, because you have a chronic condition that requires a lot of day-to-day, your physiotherapy is a very high level, and then you have the ability to apply, if you suffer from a specific condition, for additional benefits to that. But they brought in that physiotherapy limit a couple of years ago because basically people were going for massages and charging it as physiotherapy and defrauding the fund.
You can surely get the person to provide the evidence that physiotherapy is their best long-term choice.
And then on the comprehensive plans and the priority plans, they will extend the limit that they put on things like physiotherapy if you have that. But if you're on a saver plan, you are unfortunately restricted to whatever is in your savings account. Yes?
If you're on a saver, and I just wanted to confirm when you retire, like if you don't use all your savings, will that still be carried over?
Yes. Your savings is always your own money. And whatever you don't spend carries forward and continues to build, and you can spend it where you please. And even if it's for something that's not necessarily normally paid by the medical aid, you can do something called an MSA exception and ask for any accumulated funds to be used to pay for something that they wouldn't ordinarily pay.
Do you get the cover for chronic medication on key care?
Yes, you do.
You do.
Yes. It's the same kind of formulary that is available on the saver plans, and then you have two options. If you choose the GP on the key care plans, you either go and collect the medication from him monthly, or you would use MedExpress, which is the delivery mechanism where they physically deliver the medication to your home or your work. Yes.
Are all these medical expenses, including the medical aid, are all they deductible from tax after 65?
You know, they used to be. And then with NHI coming in, they needed to find funding somewhere. And one of the things that they did was reduce how much we could claim back in terms of tax. So if you're over the age of 65, there are 3 levels of being able to claim. The first one is the rebate, which is the standard value. The second one is any expenses not covered by the medical aid. And the third one is any contributions that exceed 3 times your rebate value. How that works is you determine your gross income. They then reduce your gross income or your taxable income by the value that the medical scheme hasn't paid. 33% of all the claims the medical scheme hasn't paid. Plus then your 3 times over the rebate for contributions that the rebate doesn't cover. Then they work out your taxable income, the tax payable, and then your standard rebate reduces the tax payable. So it's 33%, when in the past it used to be everything.
Could you put that down in writing?
I
understand you needed to go fast, but the detail there was too fast.
No problem. We did say that we were going to put something together. I'm doing a presentation at Org Health on the 11th, and I'll put together a little presentation and happily send it through to you.
Can I ask a
Yes.
different question which probably doesn't apply to you? Retirees who are travelling on university business as emeriti and conferences, is there a way of accessing the university's travel insurance?
Remember, if you've got the medical aid, you've automatically got travel insurance that's built in for 90 days.
Beyond that?
Then I'm not sure about what extra travel there is available, but we spoke about it earlier and said, if you're going away for a long period of time, then we put you on sabbatical and you purchase other cover, and then when you come back, Discovery will automatically accept you back onto cover without any kind of waiting periods or exclusions.
So Discovery will allow a sabbatical from Discovery?
Yes, they will. It has to be on UCT's letterhead, and it's part of the agreement that we have with Discovery that allows for sabbatical breaks, and then cover when you come back will be immediate.
And does that apply to
all members,
retirees as well?
all members of UCT. Are there any other questions? Must I wrap up? Okay. Oh, sorry. Yes, sorry.
I apologize beforehand, but I've never understood the concept of above threshold benefit. Could you summarize that for me?
Okay. If you have a plan with an above threshold benefit, what the medical aid is trying to tell you is that at that threshold level, let's say, for example, it's 12,000 Rand. Once you have spent 12,000 Rand out of your pocket and submitted proof of that expense to the medical aid, they will then take over and continue to pay from Rand 12,001 from the above threshold benefit. So you have savings account, which is your own money. You have the self-payment gap, which is your own money. And then when you've reached that 12,000 Rand limit and the next claim that you submit, as long as it's within their benefit rules, it will be paid from an insured benefit, which is Discovery's money. Does that make sense?
Yeah, practically speaking, let's not take coastal saving. So the benefit per year is what, 18, how much is the benefit?
It depends on how big your family is. So it's either 4,668 Rand for one, or it's just on 10,000 Rand for two, 8,000 Rand for two.
Yeah, it's for
Mm.
so it's 8,000 for two. So when specifically for coastal saving, do you start getting that above threshold benefit?
The saver plans don't have an above threshold benefit. You pay more on the priority and the comprehensive plans because you're paying for that additional insurance benefit. So on the saver plans, once your savings is exhausted, you're paying out of your pocket. And if your expense out of pocket is only 2 or 3 or 4,000 Rand, that's what you have to weigh up. How much am I spending? And will it pay me to pay more premium and have access to that above threshold benefit on a different plan? So is the premium differential equal to what you're currently spending out of your pocket? And then you make that decision based on that Rand comparison. Okay, I think I'm way over time now. Thank you very much.